The lady across the street at the beauty shop, she comes in to get therapy, and she was in here one day and somebody had their dog. And she said, our little Chihuahua, who is 18, she said she has all kinds of problems and she could hardly walk. And they came in and they did the therapy, and they came twice in 1 week. The dog was better. Then they put the dog on some kind of medication, whatever medication it was. The dog ended up losing complete mobility on the 2 back legs. So now the dog couldn't really stand up.
Welcome to the PEMF Effect, where breakthrough science helps take control of your health. I'm Dr. DrPawluk, and I'm here to guide you in tapping into the power of PEMF therapy for recovery, vitality, and total body wellness. From overcoming chronic pain, optimizing brain health, boosting energy, and aging with strength, this podcast is your path to cutting-edge solutions for lifelong well-being. If you're ready to move beyond symptom management and tap into your body's natural healing ability, you're in the right place. Let's dive in.
Hello, everybody. This is Dr. Pawluk, William Pawluk, and I'm joined today by Dr. Marlene Mahipat, one of my dear friends and a colleague. We've been working together for years now, and I won't try to count the number of years, but it's years. And so Dr. Mahipat is a chiropractor, and she is one of my medical team on DrPawluk.com. So she has been talking about her experiences with animals. So I'm not going to speak for her, so I'll let her introduce herself, tell us a little bit about her background, and then what her work has been with animals. And then we'll dig into the rest of the story, as they say. So thank you for joining us, Marley. I look forward to learning more about your experience with pets.
Yes. Well, thank you for having me. So as you said, I'm a chiropractor. I've been in private practice now well over 20 years. And I do the regular chiropractic stuff, children, people from all ages, physical therapy. But I also have 2 nonprofits, and one is human services and one is animal rescue. And my experience with PEMF therapy has really come through out of necessity in animal rescue. So I've been using PEMF therapy now for years on people and on myself daily, but out of necessity, as I said, it is when the animal part came to be.
What was the first time that you did PEMF therapy on an animal, and how did that happen?
So it was about 5 years ago, and through the rescue line, somebody called and said, and now this is February, so here in Maryland, that's still middle of winter. So somebody called and said that a mother cat had died, and there were three kittens. One kitten had already died by the time I got there to rescue the 2, so I got 2 of them. They were relatively young, and they'd fallen out of a tree. So this property was very woodsy, and ivy had grown up on a tree. The mother must have taken the kittens because we had a lot of snow. She had taken the kittens up into the tree. So we're talking probably a good 4 or 5 feet up in the tree. And when the mother didn't come back, the kittens fell out. And the kittens would have been, my estimate, would have only been about 7 days old. Now, in animal rescue, really in the animal world, even in a veterinary office, they would tell you that kittens that are that young, the chance of survival is really very, very low. And now with them falling out of a tree, it really probably would have been a 0% chance. So they had to be bottle fed. So I got them home, got them warm, and one of them just really wasn't doing well at all. Like very shallow breathing, barely a heartbeat. So I took it to the vet, and the vet said that this one is not going to make it at all. So I said, well, no, not on my one. I ended up calling you. I called you and I said, listen, this kitten is not going to die. I said, all I have here is a Flex Pulse. And you said, just use the Flex Pulse. So now I took the applicator on the Flex Pulse and wrapped it with a little piece of gauze on the kitten's. It was a very little kitten. So the applicator really was more than the width of this kitten. but I wrapped it. I just turned this up all the way and just kept it on the kitten. And then I was, with a syringe, I was force feeding the kitten and had the kitten in the room with a heating pad and next to the sister. So the sister was also getting treated by default of being in the same box with the other kitten. But it was touch and go for about 3 days. But this flex ball stayed. This flex ball stayed on this kitten. And that was my first experience. And to me, it was a miracle. And I took the kitten back to the vet's office and she said, this is not the same kitten. She said, this kitten should have died because her suspicion was that it had internal damage from the fall. So that really was, I was sold.
Now, how could you describe the size of this kitten?
This kitten fit in my hand about this much. It was a little kitten.
Just from the fingers down to the palm.
Yes. Yeah.
That's pretty tiny. Kitten was probably about that long.
Yes.
Right? And the coil was probably about at least 3/4 of the size of the body, right? Of the kitten's, the baby's body.
It was a brand new newborn kitten.
So you can see, just imagine this little thing, right? Now you're trying to feed it with a syringe.
Right.
Right. And you wrapped some gauze or some coil around, some gauze basically, or bandaging around the coil. And you kept the coil on the kitten, on the baby.
Yes. So I used both applicators because I actually wanted it for the kitten to be in the middle of it.
So there's one on the back and one on the front.
Yep. And took some gauze and wrapped the kitten.
Wow.
So see, I created a magnetic sandwich.
You did. It was a magnetic sandwich. Exactly correct. It was a holy sandwich.
It was.
All right. So then you kept treating the kitten?
Yes.
Are you tired of living with chronic pain? Medication only masks the symptoms, but real healing starts at the cellular level. I'm Dr. William Pawluk, the leading expert on PEMF therapy. Pulsed Electromagnetic Field therapy is a science-backed, drug-free solution that helps reduce pain, speed up recovery, and improve overall health, right from the comfort of your home. Take advantage of an exclusive 10% discount on DrPawluk.com PEMF systems. Visit DrPawluk.com, that's DrPawluk.com, to register and claim your savings. This limited time offer is available only to registered listeners. Don't miss your chance to experience the benefits. Terms and conditions do apply. Don't just manage pain, transform your health. Visit DrPawluk.com today and let's get started on your healing journey together.
So both kittens got treated. They were out of the woods by maybe 2 weeks. 2 weeks after I got them, because the little one, the one that was specifically treated, we actually named the kitten Flexi, for Flex Balls. The kitten was Flexi. So the kitten was out of the woods, and the people that called us and said that on the property, they actually took the kittens back. So the kittens, I visit the kittens often, and they are a force to be reckoned with.
So you kept feeding them for how long?
Oh, so bottle fed, they had to be fed for about 3 weeks.
How often?
Every 2 hours.
Every 2 hours. Wow.
Every 2 hours. So for the first 2 weeks, every 2 hours.
Even through the night, even all through the night.
I look like the crazy cat lady. I would lack of sleep. So I would bring them to the office because they had to be bottle fed. So I would bring them to the office and we would feed them in between patients. I posted it on social media. I had patients I had not seen in years, all of a sudden booked appointments. So it was good for business. It was good for business because I had people coming in to see the kitten, all these people taking pictures, bottle feeding the two kittens. So it actually was a good time. So they got socialized on top of everything else.
Hallelujah. And so you took the kitten back after, how old was the kitten when you took the kitten back?
The kitten was 8 weeks.
8 weeks at that point.
8 weeks, because I kept them long enough that they were able to eat solid food. They were able to go to use a little bar, be able to interact. So 8 weeks usually would be the time when, even for dogs, for cats and dogs, 8 weeks is when we would actually let them go to a foster home or a permanent home.
Okay, so their survival
So
is
before 8
basically,
weeks, we don't.
they're expected to survive at 8 weeks then. If they're alive at 8 weeks, they're expected to survive.
Right. Right.
So did you have anything else to do with that kitten after you delivered it back?
I did. I have gone and visited because it's not too close. It's not too far from my office. So I've gone back and visited. The cats are just rambunctious. They bring birds into people's house because they kind of let them roam the property.
Right.
They're inside cats, but they let them roam, bringing birds. One day I went in, and this house, it's an older style house back from the 1900s, and the roof is very tall. I can't even describe it. It's like one of these old mansion looking houses. So it's like, it looks like 3 stories, and it doesn't have a basement. And I go, and the kittens are up on the people's roof.
They're up on the house,
They climb
the roof of the house?
on the roof of the house. So they went up the tree next to the house, and they climbed a branch and jumped on the roof. And apparently that was the daily thing.
So
they were
up to a roof and stay on a roof.
Yeah, they were super kittens.
So this is an amazing rescue. This is a kitten that was not supposed to survive. So what do you think the magnetic field was doing to this kitten?
Well, the same thing it does with people, where it was repairing cells, working on the target tissue, and healing at the cellular level. And on animals, their metabolism is a lot faster than ours. So where something would probably take a few days with us to work with us, it was probably doing it in hours. So it was exciting the cells. It was repairing. It stimulated the growth hormones in the kittens. So they stuff that should have taken longer in a sick kitten, the heart, whatever the organs, probably was getting enough of the PMF to be able to, I guess, facilitate growth, because now it's able to function.
So we don't really know what the level of damage was internally in that kitten, but obviously it wasn't so bad that the kitten didn't survive.
It's not.
The kitten did survive.
Right.
All right. So is the cat's name still the same? Flexi?
Flexi, yes.
The owner kept the cat's name as Flexi?
Yeah, the cat's name is Flexi.
Fantastic. All right. Well, that was an amazing experience of rescuing from death. The kitten that should have died was completely rescued. Right?
Yes.
And does the cat come back to the office?
No, we haven't had the cat back to the office. When they get older, and they it was easier to contain them when they couldn't move about the office. But we've had my office staff. In fact, one of the videos that I did, my front desk brought her office cat just for a visit that day, and I'm here doing a video, and lo and behold, the cat walked and jumped in the video. So it's harder to contain them.
Oh, that kitten, was that kitten different after you gave it back to the owner? Was it different compared to the peer?
So it was hard to tell, because they both were in the box, sleeping together with the Flex Pulse, even though it was strapped onto one of them. They both have different personalities. The one that was treated with the Flex Pulse is equal size as the other one, and the other one was actually bigger in size when I got them. So I would say that the PMF must have done something to where that one kind of caught up in size, because the Flexi would have been probably the runt of the litter.
The litter.
And it's actually equal size as her sister.
Well, fantastic. So I'm sure you were amazingly gratified that you rescued this kitten that was not supposed to survive at all.
Right.
So what did that do to you then as a animal rescue person? What did you learn from that?
So after that, then all of the animals that came through, the bottle-fed ones, they all now started to receive PMF treatment. And I upgraded to a higher intensity device. And lucky for me that I did, because the more memorable story is this cat named Molly. Somebody came in my office, middle of winter, and he just bought this cat in a paper towel. And the cat was the smallest I think I have ever seen. The umbilical cord was still hanging on this cat. And she said, "Oh, I looked
So
through."
it was days old.
It was so the estimate at the vet's office was no more than 3 days old.
Wow.
3 days. So the chance of survival for that cat would have been really not, it would have been absolutely zero. I don't have an incubator. I'm not set up to where it's like a veterinary office where they actually can put IV or whatever they do. No incubator, no nothing. So I took this cat home, and I was pretty sure that this cat wouldn't even make it through the night. The cat stopped breathing. This was within hours of me having the cat in my possession. Stopped breathing. So I'm like, all right, I got this high intensity device. It's 2 mats. I took this kitten and I put the kitten between the 2 mats, and I turned the machine on. I turned it up probably a third of the way. And I held the kitten, so my hand was under there. I kept this kitten under there, kept rubbing the chest, almost like trying to do CPR, try to stimulate. So I was still rubbing the chest and trying to do a little bit gentle compression, and the kitten started breathing. So now is with the whole force feed thing going on, force feed. So I documented in detail daily of this kitten from 3 days old to 13 days old. I did the weight. I did the whole comparison of what this should have looked like with a similar kitten that didn't have PMF. And this kitten far surpassed all of the milestones. So this kid was able to climb out of the box that it was in.
At how many days? At how many days?
About 5 or 6 days old.
Really? Already?
Already. The kitten was able to the eyes weren't even opened yet, but the kitten was moving. The kitten started moving around. So I started to treat the kitten's formula right prior to feeding the kitten. So I would just do probably a few minutes and started to feed the kitten. And I did this with every feeding. 10 days old, this kitten was completely out of the woods. So we actually stopped the documentation, but I kept this kitten this kitten was 6 weeks old, and this kitten was doing so well, it actually was acting more of a kitten of 9 weeks old, that we were able to take this kitten into the person that wanted to rescue the kitten, take the kitten into her house. This kitten was already drinking from a bowl. The kitten was using the litter box. The kitten was responding to its name. The kitten was making a lot of mischief. So that was probably one of the reasons why we took the kitten. So they still have the cat, and the cat's name is Molly.
Molly the cat.
Molly the cat. And Molly, what I have noticed with the cats that have been treated with PMF, they are more confident. The word is not aggressive. It's more confident, but they play rough. More active. So Molly is Molly the dog, because when the girl Molly was a present for the little girl in the house. So when the girl's friends come over, the girl is like 9 at that time. When her friends come over, for whatever reason, if Molly does not like one of the friends, she will chase her, like chase her out of a room. And I've been there. Molly once stole an entire sandwich off of the table, took it behind the couch, and ate the entire sandwich. So Molly is definitely not the typical cat. I've had cats.
Have you ever seen a cat eat a whole sandwich before?
No, neither have they. Molly steals laundry, and Molly's particular. Molly will steal clean laundry. So if they do laundry and take it out for the dry and put it in the basket, Molly will go in and drag socks and drag towels and drag stuff across the floor. So Molly is the super cat.
A super cat. Is she bigger than her
She's
peers?
bigger.
She's bigger?
Well, we didn't have any siblings, but they have another cat in the house that is 2 years older than Molly, and Molly is way bigger than that cat.
Really?
Like way bigger. And when the owner took Molly for the first visit to the vet, she says, no, this cat is not 6 weeks old. This cat is 10, 12 weeks old. She said, no, these people had the cat from such and such. They swore. Now they say the cat is overweight because the cat, if you're going to document that this is what the age is, there should be a certain weight. But this cat is heavier, but the cat is not fat. The growth hormones were stimulated, so the cat just grew.
Wow. Now, Molly's very aggressive.
Molly is aggressive.
And that's, well, I guess that's a good thing. If Molly was an outside cat, she'd probably be a terror.
Molly's scared of outside.
She's scared of being outside.
Yep. They would put Molly on a harness and take Molly outside, and Molly's scared of outside. Interesting that she doesn't want to go outside. So then they put her in this carrier that you push, and she will go outside. But the minute you try to open the carrier, she will be screaming. So go figure. Molly the dog.
Molly the small dog.
Yeah.
The big cat, the small dog. Have you had any other experiences with pets and the PEMFs?
I've had quite a few experiences. I haven't had too many experiences with small dogs, but in my office, I have friends of mine who bring their dogs in to get therapy. My front desk girl, her sister's dog, was chasing a squirrel in the backyard, did something to her hip and her knee. She was limping, she couldn't walk. So they booked a veterinary appointment, but the vet couldn't see them for a few days. So the day after this happened, they brought Jojo in to the office. I have a high intensity device in the office, and we used the loop. We did 2 treatments, and she wasn't happy with us because, of course, the involuntary muscle contraction, she wasn't really liking that, but we kept up with it. She left out of here. She was walking better. She was able to walk, but there was still a bit of a limp. So the next day, my front desk girl says, guess who is running and chasing squirrels in the backyard? Jojo. So they canceled the vet appointment. This was a few weeks ago, and she's fine. Then they didn't have to keep the vet appointment. And that treatment, that 1 day of treatment, whatever happened to her hip was fixed.
And how old was this critter?
Jojo is 7.
7 years old.
She's 7 years old. She is a yellow lab.
A yellow lab. So
yep.
At 7 years old, that's a full-grown lab.
It's a full-grown lab.
You were impressed, clearly?
I was very impressed. And people have brought their dogs in. Some of them have anxiousness. So we just put them on the mat. So the owner is getting treated also, because if you have an anxious animal.
At the same time, you treated the owner and the animals there with the owner.
Yep.
We hear this all the time, don't we? That when the owners do magnetic therapy, the critters often come to get their treatment too.
Yes, actually, in my house, we have 2 dogs. They would be in the room when I'm getting treated, or when my husband Chris is getting treated. And sometimes, if Chris's allergy is acting up, he wouldn't want them in the room. They will go and they would scratch on that door of the treatment room, because they're hearing the machine going, they're hearing the clicking, and they want to be in there because it makes them feel good.
Now, do they climb on top, lay on Chris or you, or are they beside you?
So most of the times they would lay beside us, pretty close, because the bed is very low. So they're laying right next to us. if they have Sadie had bad joints. So with Sadie, we would actually take one of the full body mat and just wrap it around Sadie.
Full body mat and wrap it around like perpendicular.
Her body. Yep.
Yes.
Yep.
So like a tube, essentially.
Right. Right. Well, we always said Sadie was fat, so we said Sadie was a sausage. So that was pigs in a blanket.
So it was a pig in a blanket. Okay.
Yep.
All right. Any other good experiences that you have had?
There's been a lot. I would say more so the animals, the younger ones, the ones who are the bottle feeding critters. Those are the ones. But I wish that I had known about PMF years ago. And I tell this to all of the people in the rescue world and all of the pet owners, that when my very first cat that I took into rescue, Kitty KTZ, so Kitty lived to be about 15.
Wow.
At the end, Kitty he clearly was in pain. The joints was going. He was a rescue. He was almost, he was washing away. We had a lot of rain. The mother had drowned and a bunch of the siblings that was doing Meals on Wheels. And in the parking lot, there's this cat laying in water, this kitten. So he was just about drowned. I took him to the vet. They were able to rescue him. He was young. He was probably about 4 weeks old. And so when Kitty got older, to see him suffer like that, to see him, now they have to put him, he was on tramadol, he was in gabapentin, he was on all of this stuff. His personality wasn't the same. And I wish I had known about PMF, because it would have helped him with the pain and whatever else was going on with him. And it would have still maintained whatever personality he had. And the same for one of my first rescue dogs. When I was in chiropractic school, we went to the flea market, and it was the middle of July, and there was this puppy tied up to one of the tables. Somebody had just left him. And this was Sunday, so he would have died out in the heat because the flea market was closing, and they only come on weekends. So Fluffernutter, my dog Fluffernutter, I have him.
Fluffernutter?
Fluffernutter, like the sandwich, Fluffernutter. He was poofy white with just a little bit of brown. And I had no idea what Fluffernutter was. Somebody in my chiropractic, in my class, he actually named him. He said he looks like a Fluffernutter sandwich, which is marshmallow and peanut butter.
Okay. In case we didn't know what it was. Yes. Thank you.
Right. Yes. So Fluffernutter, I had him. He was 15 and a half. The last 3 years, he was not good. He was not good. It got to the point where we had to pick him up and take him to go outside to go to the bathroom. He couldn't walk. He was on tramadol. He was on all kinds of medication. All he would do was sleep. That's all he would do. He would sleep, because and the personality wasn't the same. He used to love to bark at the raccoons when they come up the front step to eat the cat food. He would bark at them, and I knew it was time. It was time to put him down, because he was right there sleeping, and the raccoons came up and he didn't even bark. And he was not, the last year he was not the same dog. And if I had PMF, he would have gotten treatment every single day and still be able to maintain some level of dignity and not be this drugged out, this completely drugged out animal.
So that's one of the things that happens with PMFs and pets in particular. They don't talk to us like humans talk to us, right? So we have to sort of interpolate their actions and say, here's what's probably going on with this animal. So your experience with your dogs right now is that if that dog had Fluffernutter, had PMF, it would have been a whole different story for you.
It would have been a whole different story, because he would have gotten PMF treatment every day, so he probably wouldn't have gotten to the point where he was so arthritic and whatever else was going on, organs, whatever. He really would have not aged the way he did, because with PMF, I say it's anti-aging, because if it's gonna fix oxidized cell, a damaged cell, and try to make it as brand new as possible, that's anti-aging.
It is, and aging is, we now call it inflammaging, right? So it's inflammatory aging, inflammaging. What other kinds of animals have you worked with PEMFs?
Rabbits. My friend Jen brings her rabbit Violet here. So we've done rabbits. We've done birds.
You have done birds.
So we've done birds with broken wings. You just got to put them in a like a cat carrier. Put them in a cat carrier, and then you just put them in the middle of the loop, and then do the treatment. So I've had people bring several animals to the office. I haven't had any snakes, thank God. Nobody, please don't bring any snakes. Chris would probably be doing the treatment on the snakes. I would not be doing treatment on the snakes. Yeah, so we've done, but mostly domestic pets.
So you could see that you could do magnetic field therapy for animals from birth to death, right? Across the lifespan of that animal.
Yes.
What's the oldest animal that you've ever treated?
The oldest one I've treated in this office would probably be 10 years old.
Dog?
A dog.
Dog?
Large breed dog. No, I correct myself. The lady across the street at the beauty shop, she comes in to get therapy, and she was in here one day and somebody had their dog. And she said, our little Chihuahua, who is 18, she said she has all kinds of problems and she could hardly walk. And they came in and they did the therapy, and they came twice in 1 week. The dog was better. Then they put the dog on some kind of medication, whatever medication it was. The dog ended up losing complete mobility on the 2 back legs. So now the dog couldn't really stand up.
Your body was designed to heal, but illness, chronic disease, stress, injury, and time can slow that process down. What if you could restore your body's natural ability to recover, recharge, and feel its best? The key to healing is giving your body the energy to repair itself. PEMF therapy does exactly that, recharging your cells, improving circulation, reducing inflammation, and helping you function at your best. For decades, I've studied this technology, worked with hundreds of medical professionals, and helped thousands of people reduce pain, regain energy, and take control of their health. However, not all PEMF devices are created equal. No one size fits all. We offer personalized consultations so you can find the right device for your needs, backed by real science and trusted results. If you're ready for a real solution, let's talk. Schedule a consultation at DrPawluk.com. That's DrPawluk.com, because real healing starts at the cellular level.
At that point, the PEMF, I don't think the PEMF was going to be enough. They came in, it probably made the dog comfortable, but they eventually had to put the dog down. So that would be the oldest dog.
So your experience is that with your dogs, obviously you could treat the animal across the lifespan of the animal.
Yes.
Good chance that they would live longer. And if they have injuries, they would recover faster. Clearly that's clearly something you've seen.
Yes.
Have you done any treatments on animals after surgery?
Yes. Actually, yes. My front desk girl, the other cat, Snowflake had to have some surgery on a tumor that it had on the side of his neck. Snowflake didn't like the PEMF therapy, but Snowflake came and got therapy. And Snowflake was an older cat. Snowflake was over 13, and he healed very well.
How many treatments did you do to Snowflake?
Snowflake got about 6 treatments.
6 treatments. So these are, so even without doing daily treatments and doing it over a longer period of time, the animals still respond tremendously well for that.
Right.
Right. So that's one of the uses, I think, for PEMF therapy. Go ahead.
Yeah, I really think that every person who owns a pet should have PEMF therapy for their pet. Over the years, there's pet insurance, almost like people's health insurance. There's pet insurance. Instead of spending the money with pet insurance, invest in PEMF. This is your insurance. that your pet is going to be the healthiest it could possibly be, that it doesn't need to end up at the vet's office, except for routine vaccination and whatever, it would not end up in emergency care at a vet's office. So that should be the pet insurance.
Now, clearly you're treating your dogs with higher intensity magnetic fields.
Even the cats.
And even the cats with high intensity magnetic fields. Now, maybe pets don't need, but if a human has a system at home anyway, then you don't have any concerns about the kind of machine or how strong the magnetic field should be?
No. So Cosmo is one of the cats we rescued 2 years ago from underneath a dumpster. And Cosmo, he wasn't old enough to be eating solid food, but I don't know how long he was underneath the dumpster. So he ate a bunch of stuff and he threw up, and he was one that I used high intensity on because he wasn't eating. He wasn't eating and he kept throwing up. When I used the high intensity between the two mats, like I did with Molly, he threw up, and he threw up a whole bunch like rope. So that was causing a blockage. So after he threw up, after that, Cosmo sometimes we shut the door. So Cosmo would jump up on the bed and jump up on the mat to the point that his whole body is in convulsion, involuntary contraction, and you can't put him off. You can't put him off the bed. Chris is allergic, so Chris always knows when I let Cosmo on top of the mat, because when he comes in, he's like, my allergies or going crazy because you and Cosmo were up on this mat. So it's not that you don't even have to force them. Once they get used to it, they know that it makes them feel good, and they will want to do the therapy.
So you don't have a concern then, obviously, about the strength of the magnetic field. In fact, you do the full spectrum of magnetic field therapy on the animals. So you're not concerned about risk to the animal with high intensity?
No.
Have you ever seen any side effects other than the cat vomiting rope?
When Cosmo gets up on the mat, and if he does more than 10 minutes, when he gets off, he gets the zoomies. And he's running through the house, and he's knocking everything down and knocking even the dog. The dog is 85 pounds, and he's jumping on the dog. So he becomes this super cat. He's a panther.
The panther cat. So he's regressing. He's regressing. It's like turning a bird into a pterodactyl or something, right?
Yes.
Fantastic.
So that's the side effects that I've seen. I haven't seen any negative side effects. In the same way with people, I say low and slow. With the pet, I kind of monitor how it is. You try to do low and slow, but sometimes if you have an animal that in such dire need, like the ones that I've had, you just do whatever you could to try to get enough PEMF current energy into their cells. And then after that, if you have a pet that you're now introducing to PEMF, I think the older ones definitely are a little bit suspicious. They're a little bit skeptical. This thing making this clicking, this causing this involuntary muscle contraction. I think they're a little nervous, and maybe they need to do the low and slow.
Okay. Yeah, probably so. How long did it take for Cosmo to settle down after a treatment?
Cosmo can go like that for an hour.
An hour?
Cosmo can go for an hour. The zoomies.
Just zooming around for an hour.
Yeah. And high speed.
At high speed. Get out of the way.
Yes. Knock you down if you're not careful.
So it became a little manic. So that's something to watch out for potentially, right?
Right. But the girl cats become aggressive, but the boy cat, because Cosmo is really, now I think about it, out of the rescue, Cosmo is the only boy cat that actually got PEMF as a little kitten. And Cosmo is such a sweet cat. Cosmo is gentle. Cosmo is nothing like you would expect a male cat to be. when we got last year, I got another one, somebody, the same guy that brought Molly, the same one shows up at my office with Grace, who was probably about 7 or 8 days old. We had Grace in the room again with the flex balls and also high intensity. We went back and forth with both. The door was open and we had a baby gate. Cosmo went in there, and Cosmo was the one that was cleaning her and stimulating her to go to the bathroom. Cosmo was the one, he slept with her the first 24 hours. He didn't leave to go eat. I'm in the kitchen in the morning and I see an animal jump over the fence. Cosmo had Grace in his mouth like a mother cat would because Cosmo wanted to go to the bathroom. So Cosmo, the litter boxes are actually on the screened-in porch through the dog door. That's where he was taking her so he can go to the bathroom. Chris didn't believe it. We had to look at the camera in the house. We had to rewind the camera so he can see Cosmo jump over the fence with this little kitten in his mouth. So he's like a mother cat. So he's very sweet. So maybe if you have an aggressive male animal, maybe PEMF therapy.
It'll settle the animal down. Although obviously you could do jazz up a female cat.
Right. The female cat and builds testosterone. So see? So maybe that's it.
Yeah, who knows what. Or else just really stimulates the nervous system. So it increases adrenaline potentially, right?
Yes.
So I guess if you were a veterinarian, you would recommend PEMF therapy all the time.
Yes. And actually I recommend it to veterinarians. One of my board members on my animal nonprofit is a veterinarian. So we're going to have the conversation to where we're going to do workshops to where we have people come in. We'll teach them about PEMF and pets.
Fantastic. I have a story about a woman who was working with us on our team, and she bought some portable devices like the Flex Pulse, but she was also using a high intensity system as well. So the first time she treated a horse, the horse was nervous and skittish, but by the time she was done the treatment, the horse was completely relaxed. And the people who work with horses tell you when the horse puts their leg up, right, it sort of hangs it, that means they're very relaxed, right? So the horse went from stressed to very relaxed. So the next time she came to the barn with her carrying cases, the horse ran into the barn before she actually got into the barn. The horse ran to the barn for its treatment. So she said the animals, even the large animals, they respond extraordinarily well, and they're very sensitive to these systems. And PEMF therapy does acupuncture. Well, we know that. So one of the actions of PEMF therapy is an acupuncture-like action. So again, acupuncture can be very, very relaxing for animals. And so animals do eventually gravitate to it, and they will come back and get their treatments.
Right.
Horses.
So in South Carolina, when I did my animal adjusting certification, we worked on horses, and we actually worked on the dancing horses.
Okay.
The word I can't remember. The ones that actually walk in this dancing pattern. Right. So those were the ones so we went up to a farm and we worked on these horses. And the same thing, when the horses saw us coming, they would come running because it's the ones that we were used to working on. And they will actually turn to where they want us to work on. So sometimes it would be the neck.
They would actually offer you the part of the body that they want treated.
Yeah.
Really?
It was the most interesting thing I have ever seen. Horses are hard to adjust. So you have to get up on a ladder. So it's a lot of trust on our part that they wouldn't just knock you off the ladder. And when you adjust them and you adjust their neck, you're actually using your fist. And when you do the hips, you're actually really using your whole body weight. And they loved it. They would come running out of the barn, the same thing. They're smart animals.
They're smarter than you think.
Yes.
All right. Well, I know there are a lot of people who do magnetic field therapy with horses. So there are devices that are being sold primarily into that market, into the equestrian market. And I have had people tell me that the horses will run faster. So when they're doing training, So they do the magnetic therapy before they do training or before they do running or trotting or whatever, then they do better. They could run faster. So we know that's true with humans. We know athletes perform better if they do magnetic field therapy before they do their performance. And of course, we do know that with athletes as well, one of the biggest problems with athletes is not performance so much as it is recovery, so that they can maintain performance after injuries and treatments and so on. So maybe you may have to explain to people what an adjustment is.
Oh, it's an alignment. So I'm sure a lot of people are familiar with chiropractic, but a lot of people
That's what chiropractors do, is they do adjustments.
Right, but they're not familiar with animal chiropractic. It is the same concept. You look for the misalignment and you actually put it back in alignment, free up the communication system in the central nervous system, and everything now is able to function the way it was meant to function. And back then, if we had PEMF to actually add to that whole equation after the alignment and the PEMF, they would be super horses.
It goes without saying. So basically, it activates the nervous system, and it increases energy in the tissues. It increases ATP production. It increases what we call myosin phosphorylation, which again is to increase ATP in the tissues, in the muscle. So that is amazing information and work. Anything else you want to say about using PEMFs in animals?
No, I think everybody should have a PEMF device for the animal, and hopefully one day there will be such a device that people are able to attach to their pet like a vest while they're in the house and running around or even walking their pet. They can get treatment at the same time.
Treatments. There was an interesting study. So animals are often studied before they're used, before the treatments are used in humans. Right? Because if it's going to work in an animal, then we understand that it's going to work basically all biology, anything. It doesn't matter what kind of biology you're dealing with. So this particular study, guinea pigs are often used as a model for arthritis. And so what happens is 100% of guinea pigs, even though they live in a cage, get arthritis, 100%. Well, it's a model in humans because the guinea pigs, whatever you do in a guinea pig is going to happen faster. So you can see the results of treatments much faster than you would in a human or other long-living animals. So what they found is that they've had a group of guinea pigs that they treated with magnetic field therapy, and they were at different stages of age. And they had another group that they just used as a control group. They just observed their arthritis development. And what they found is that when they treated the guinea pigs with magnetic field therapy, and they died, when they died, they did autopsies on the guinea pigs. And what they discovered is that if they had different stages of arthritis, that the arthritis was healing in the guinea pigs. So you actually saw evidence of healing of the 100% development of arthritis in these guinea pigs. So it healed. So basically what it was doing is, in a sense, it was preventing the development of the arthritis process. And of course, it did it very quickly because guinea pigs don't live that long. So that was an impressive study on how PEMF therapy, we say that PEMF therapy should be able to recover arthritis in humans. The problem is that humans they live much longer lives. So it's harder to know to what extent, the magnetic field therapy is preventing the arthritis. But you can assume that if you're, say maybe your 20s or 30s, and you're doing PEMF therapy on a consistent basis, that you should be able to prevent or reduce the risk of developing the arthritic process. The problem with arthritis is that if you do it too late, you have to have cartilage left to be able to stimulate that cartilage. So what happens then is magnetic fields actually will cause the cartilage to grow at the edges of the cartilage. So you need cartilage. You need what we call a scaffold for new cartilage to grow. So if you're bone on bone, you're not going to regrow cartilage. But if you, and for prevention purposes, I think that anybody who is doing a lot of athletic work in their life, they're injuring themselves all the time.
Right.
And so if they're doing magnetic field therapy on a consistent basis, not just for treatment here and a treatment there, but if you're doing it on a consistent basis, daily basis, which is what happened in the guinea pigs, they were getting treatment every day, then you should be able to prevent arthritis. Again, and you have cartilage left to be able to regenerate the cartilage.
Right.
So there's another sort of lesson for us from the animal world on how animals are telling us what will happen in a human.
Yep, you're right.
All right. Is there anything else you want to part us with?
No, I think that was it. The rescue world is better for PMF, at least in my rescue world. I would say that I've been doing animal rescue well over 20 years. I have yet to lose any bottle fed or puppies. I've yet to cats or dogs. It really, before I got PMF, I never had kittens that were that young. And once I got PMF, I was doubtful. Those were the first times that I was doubtful that I would even be able to have these animals stay alive. The vets also say the same thing, that it's almost impossible. So I would say that probably this should be something that veterinary emergency care clinics probably should have as part of one piece of equipment.
So, and I know that there's some evidence, and the veterinarians talk about this themselves as well, is that sometimes stop medication, and if you can't stop it, you can reduce the dose. So if you're doing magnetic field therapy combined with medication that you might still need for whatever purposes, then you could decrease the dose. So there's decreased risk of side effects as well when you decrease the dose and combine it with PEMF therapy.
Right.
So I know that dogs, horses, cats, other livestock, interestingly enough, in livestock, in cows, magnetic field therapy can be very useful in cows. For what? Mastitis.
Right.
Right. For the nipples, for the udders in the cows, they get infected. Spawn. So if you do, and humans develop mastitis, and there's evidence, in fact, in humans and women who are trying to breastfeed after delivery, they can breastfeed longer if they have PEMF therapy, because the nipples get infected, the nipples get cracked, and so that leads to infection inside the breast itself as well after that. So mastitis is common in women post-pregnancy, and so it can be very helpful for that. So obviously it works as well in cows to help to treat the udders and the breasts in the cows.
It would completely make sense. I do a lot of moms, brand new moms in my office, and a lot of patients with C-sections actually come in and get PEMF therapy because it helps with the healing.
With pain and healing, yes.
Yeah, and the healing. And with the mastitis, that actually was quite interesting, because that is also one of the things that we do in the office. A lot of times the milk production is not there, and I've actually had two moms in the last 2 years that have come in, and the milk production was able to be increased using PEMF.
Well, again, PEMFs are magic, right? And all the things that they do and how they stimulate the body to be healthier. There was actually a study done on dogs who had surgery, and so back surgery. So back surgery, obviously, the dogs are really significantly affected by the spinal lesions, arthritis in the spine, disc issues in the spine, and so on. And often they need surgery. So the studies showed that dogs recovered much faster after the back surgeries. And I've actually seen dogs that were crawling, and I've heard from other people, dogs that were crawling, they could not carry themselves with their back hind legs. They did PEMF treatment and they started running. They were not even walking with their hindquarters. The hindquarters just were not working. And all of a sudden they started, running. They started walking. So it could be amazing post-operatively for sure in animals, and they heal much faster. So I consider, I hope nobody takes offense at this, I consider animals and children to be somewhat comparable, because their biologies are growing rapidly, extraordinarily rapidly. And they're producing, as you said, a lot of growth hormone, and they're very sensitive to magnetic fields. So animals, as you have pointed out, are very sensitive to the magnetic fields. So young children who do magnetic field therapy for whatever they have a need for, I wouldn't do it routinely in a child, but if there's any problems like with abdominal issues, gut issues, fractures even, arthritic issues in children, respond extraordinarily well with PEMF therapy. However, there's a caveat, and I've talked about this in some of my material, is that you have to be careful with PEMF therapy that you're doing relatively equal therapy across different parts of the body. So in other words, you shouldn't be just treating one hip, right? You should be treating both hips, because what happens is the magnetic fields that stimulate the growth in the hip, the plates, the growth plates in the joints. So if you're stimulating one more than you're stimulating the other, then that one can overgrow compared to the normal. So you should be bilaterally stimulating equally the body, preferably the whole body, actually, quite frankly. Any parting words, Dr. Mahipat?
Nothing. Thank you so much for the training, for the insight, for this knowledge. I am so much better for knowing you.
Well, thank you so much. And likewise, too. We all share our experiences. We learn from each other. Thank you again for joining us and for sharing your time and your experience. Have a great day.
Thanks for joining me on the PEMF Effect. I hope today's conversation gave you new tools, insights, and inspiration to take control of your health. If you enjoyed this episode, don't forget to subscribe, leave a review, and share it with someone who could benefit from PEMF therapy and holistic healing. Your body has the power to repair, recover, and thrive. Sometimes it just needs the right charge. Until next time, stay curious, stay proactive, and keep powering up to better health.